Good afternoon, ladies and gentlemen. It's a great honor for me to be here, and I want to thank the Society to invite me to give this lecture to your Society, and especially Dr. Drahomira Springer to this point of care session. So I am going to tell you a little bit how we have organized the point of care testing and especially the quality issues in Finland. We have several trends going on. Laboratory testing is highly centralized in public and private sector in Finland. Point-of-care testing is widely used also in primary healthcare and social welfare institutions. And as we all know, the analytical performance of point-of-care tests is very good nowadays, sometimes even better than traditional laboratory tests. But there is a big but. Total error is sometimes too high for clinical decision-making, especially concerning the errors that comes from preanalytical phase. Here is an image which shows what's happening in Finland. The blue and red lines are number of laboratories during last 10 years. And as we can see, it started from almost 400 laboratories, and today we have less than 200. And this is because of the high centralization. And at the same time, of course, point-of-care testing is growing fast. And more analyses are done by point-of-care testing. Few words of Finnish healthcare system. Our population is 5.5 million people, and it is aging fast. Municipalities are organizing the primary healthcare services and special medical care by law. And specialized medical care is organized through 21 hospital districts which have central hospitals. And services are financed by taxes and support of the government. Private sector covers around 30% of all healthcare services in Finland, and major part of private sector is doctors' offices and occupational healthcare services, which are by law in Finland. An interesting point is also that international investors are buying Finnish private healthcare companies increasingly. So what is the role of these hospital districts when we are talking about laboratory medicine, laboratories and point-of-care testing? Hospital districts have the responsibility by law to control, monitor and ensure the quality of public laboratory services and other special services like radiology. And point-of-care testing in public organizations is under the control of hospital districts as well. Accreditation service in Finland has also own opinion concerning the point-of-care testing. Finnish Accreditation Service has decided that point-of-care testing accreditation is possible, but it's possible only for medical laboratories. So it have to be done by ISO 15989, and the responsibility is for laboratories. And the key factors for Finnish is that there have to be an agreement with the laboratory and point-of-care testing units. Laboratory make the validation of point-of-care instruments and validation of the users, training all the users. And medical and analytical expertise is needed always when we are dealing with point-of-care testing. Internal and external quality assessment is, of course, mandatory for accredited laboratories. So it is possible, but only if the laboratory is doing it. And we have some point-of-care testing units already accredited in Finland. Another thing is that we have also done a national recommendation how to organize point-of-care testing and how to ensure the quality. And this was made by a quality company. We organized a group of laboratory experts and created a recommendation in 2009. And the main messages in this recommendation is that support of laboratory is always needed to obtain sufficient quality level. So it means that there is no high quality point-of-care testing without supporting laboratory. And if the point-of-care test results will be used for clinical decision-making, the analytical quality requirements are of course the same than traditional laboratory tests. There are no exceptions. And training of the users is one of the key factors in POCT quality. It doesn't matter if the internal quality control is done very well or EQA is doing well if the preanalytical phases are not under control. And continuous IQC, EQA are of course needed for quality measurements. And here is the picture of our recommendation from 2009 and a group of experts. There are two biochemists and two microbiologists who made the recommendation. So if the supporting laboratory is so important, what are the responsibilities for the laboratories? We have decided that the laboratory shall name the responsible persons who are responsible of the point-of-care testing in totally. They have to establish multi-professional steering group for point-of-care testing, plan the use of POCT and laboratory tests. This is very important. Which tests shall be done in laboratory or sent to the central laboratory, and which tests shall be done by point-of-care testing. They evaluate the cost effects and clinical benefits of the point-of-care, select and evaluate the test and instruments, organize the training, organize the IQC and EQA for POCT, and create all the instructions and documentation which are needed. Most of these things would not be done if the point of care is only in the user's hand. This is a model how it's organized practically in Finland. We have those 21 districts where they all have this central hospital. And under the central hospital there are some local hospitals which belong to the same organization. So the laboratories are in the same organization in central hospital and local hospital, and more also in primary healthcare. Municipal laboratories belong to the same laboratory organization. And now the local hospitals, sometimes also the central hospital, name supporting supervisors. There must be a clinical microbiologist, there must be a clinical chemist who are responsible of the point-of-care testing supporting in the whole organization. And when we go to the point-of-care testing level, those primary healthcare laboratories or point-of-care test units, there are small laboratories where there are biomedical laboratory scientists, and they act as a POCT coordinators, take care of the training of the POCT users, inside the hospitals, inside the laboratories, and outside the organization. And in private sector, the model is quite same. What kind of training we have for point-of-care testing for laboratory professionals in Finland? Biomedical laboratory scientists, they study 4 years in University of Applied Sciences, and they get very well trained for the laboratory medicine and biomedical science. They have a possibility to specialization to point-of-care testing. It's 1 year specialization, and this has been available 4 years now. So we have quite many specialized biomedical scientists in Finland. For clinical chemist and microbiologist, the system goes that the specialization is almost same than you have here after the university, 4 years more for clinical specialization, and POCT training is usually included to that training but not requirement. So point of care specialization is more by own interest. But these people, they come to the point of care supervisors in those supporting laboratories. But if we look at the users, what kind of training users have in Finland? Most of the POCT users are nurses, and for nurses the training is the same than biomedical laboratory scientists, 4 years University of Applied Sciences, but they have only 2-week course of laboratory testing, mainly phlebotomy training, some small courses of laboratory test, and also in microbiology courses there are some specimen collection courses. Mainly they learn how to use point-of-care test by orientation at workplace or instrument provider training. The problem is, of course, that those people who are doing the test, they are not exactly qualified to do those like we are as a laboratory professionals. Here is a list of national activities, what we have now done to try to improve this. We made that national recommendation that I already showed to you. We have certification services available for point-of-care users. We have training for point-of-care supervisors and users twice a year, national point-of-care days. And then we have a new product called POCT Certificate for point-of-care users. And the certificate is available at the moment for glucose meters, CRP, HbA1c, INR, and EGG, and spirometry is coming in the end of this year. Then we have a recommendation, of course, third-party internal quality controls that shall be used for POCT, and we have a quite large variation of EQA schemes suitable for POCT. This POCT certificate is an e-learning service for point-of-care users. And we created this because laboratories who are responsible of training all the users, they don't have enough resources to do it because there are so huge amount of nurses and doctors to be trained. So we created this kind of e-learning process, and it takes around 1.5 to 2 hours to go through the training materials, and it includes background information of the tests, sample collection, evaluation of the results, quality assurance issues, and general instrument handling and maintenance issues. This does not include all the instruments, of course, because there are so large variation of different kind of meters. This is still the instrument providers' task to learn to use them. But after this training material, there's a final exam on the website, and you have to get 90% correct answers to get the certificate, and then the certificate is valid from 1 to 3 years. It's basically the organization who can decide how long they accept it and when the users have to make the test again. And this is very popular at the moment. Many big organizations have ordered this product for thousands of nurses to keep them aware of all the needed information for point-of-care testing. The training material includes videos, pictures, and of course written materials, and here is an example of the certificate done. If we think about the point-of-care testing as a process, there is a request, then we have to give some kind of instructions to the patient how to prepare before the testing, and we have to take the sample, and we have to know the instrument, how to use it, and then we make the analysis, and after the analysis we should be able to evaluate the process. Is this process done in a correct way? Can I trust the result? And as we know, it doesn't matter if we have very well done IQC in POCT analysis, or we have always succeeded in EQA, because the errors, they come from preanalytical phase. There is a poor patient instructions, there are poor sampling maybe, and poor knowledge of the instruments, and then after that it's not possible to evaluate the result accuracy. So this picture shows clearly where we should point our efforts to make point-of-care testing more, that we could have more quality in point-of-care testing. I used my time, so now it's the time to have a small advertisement. We have in Finland every year our own Congress on Quality in Laboratory Medicine, and next year we have decided that themes will be preanalytics and point-of-care testing. So if you want to hear more of our activities or are interested in these subjects, you are all very welcome to Helsinki, 11th and 12th of February. Dziękuję.